The heel is at a much lower angle than the dorsal hoof wall, but we can also see enlargement of the palmar soft tissues in the distal aspect of the pastern, highlighted by the yellow arrow. Ultrasonographic evaluation told us that there was significant injury, degeneration of the deep digital flexor tendon. Note also that the branches of the shoe of this foot are too short. They provide very little support to the palmar aspect of the foot. Don't underestimate the influence that trimming and shoeing can have on soundness. If, when you examine the horse, it has had an abnormal shoe applied with or without a pad, ask the question, how long has the horse been shod with this pad and the graded shoe? Why was this done? Has it made any difference to the horse's movement? I think the use of hoof testers is hugely important, bearing in mind that they have some limitations. If the horn is very hard, the absence of a response to hoof testers does not preclude a subsolar abscess, a fracture of the distal phalanx as seen in this radiograph, or laminitis. There are various designs of hoof testers. I have two pairs illustrated on the right. The smaller pair I use for ponies and for foals. The larger pair I use for most adult horses. The application of hoof testers is a two-handed job. I want to be providing sufficient force. I place the limb between my thighs in order to be able to use both hands and also in order to be able to feel in a fairly sensitive manner if the horse shows slight reaction to palpation. I palpate the foot with the hoof testers or apply pressure with hoof testers in a systematic way, starting medially and gently and working all the way around the foot, and then reapplying the hoof testers using firmer pressure. Bear in mind that a horse with a subsolar abscess may be really reactive to pressure when you find the site of the abscess and may react violently. There is the potential for the horse's reaction to be such that you are flung across the room. I also find it useful to percuss the hoof wall in order to see whether or not there is any reaction to percussion, perhaps associated with a tight nail. Also to determine whether or not there is a normal resonant sound or whether there may be an area which is abnormal, reflecting separation of the hoof wall. Look very carefully at the growth rings. In a normal horse, the growth rings are equidistant from dorsal to palmar. In this horse, with a cresty neck appearance and fat deposits behind the elbow, we can see that the hoof capsule is slightly distorted in shape, being slightly concave, and we can see by the double-headed arrows that the separation of the growth rings is greater towards the palmar aspect of the foot compared with dorsally.